Well, hello everyone, and welcome to another episode of the Alberta Doctors Digest podcast, brought to you by the Alberta Medical Association. As always, I'm your host, Editor-in-Chief Marvin Polis. On this episode, I'm in studio, and joining me remotely from Calgary is Dr. Heather Patterson. Dr. Patterson is an emergency physician at the Foothills Hospital as well as the Alberta Children's Hospital, and she's been working on an amazing project. Heather, tell me all about this.
Thanks, Marvin. So I have been photographing in Alberta's hospitals now for almost 8 months with the intention of capturing our frontline COVID response, basically from a variety of perspectives, both our clinical and non-clinical staff, as well as to share the experiences of patients and families as they journey through the pandemic.
Now, what have you been experiencing and what has your camera lens been capturing?
It's been a real journey for me, I would say. Starting out at the beginning of the project, I think I recognized early on that how I was feeling myself and what I was experiencing through the pandemic was becoming apparent in my images. So at the start of this project, I found myself capturing moments of uncertainty, apprehension, loneliness of patients, and feelings of isolation. But very quickly that transferred into feelings of appreciation for what our staff and our teams, both clinical and non-clinically, were accomplishing. And so I started capturing moments of humanity shared between people and their patients, hand-holding in moments before intubation, talking to families over FaceTime with patients, saying goodbye before they went under for a major procedure or for an intubation. And so there was a real shift. And then further on in this project, I've been able to capture the resilience of the human spirit, watching people as they journey through their COVID experience, starting with intubation and ICU stays and ending with a protracted recovery period and being reunited with families.
Now, what was it that made you think in the first place, this is something that I just have to do?
At the very beginning, this was designed to be a wellness-based project where I wanted to capture what it looked like and felt like to be an emergency physician. And the idea behind that was simply to capture the journey as I've been going through emergency medicine over the last 11 years as staff and 5 years as a resident. And when that expanded to include the pandemic, then I started to realize the broader impact we could have by having a visual representation of the purpose and the privilege of working in healthcare.
Now, it seems to me that a pandemic like this is something that rarely happens, and hopefully we never see something like this again. Did it occur to you that somebody needs to document this for posterity?
Absolutely. I think although this started as a wellness-based project, it very quickly became apparent that there was limited access for the media or other photographers to be documenting this historic time. And from that perspective, I felt a real privilege and honor to be able to be a physician with different insights and perspectives to be able to share what was happening behind closed doors.
Now, clearly, as we look at these photographs, you are a very skilled photographer. Is this something that just comes to you naturally?
Well, I learned really to photograph on my own. Trial and error and thousands of rolls of film and now hundreds of thousands of images on a digital camera. But I have taken a number of online courses and then through this project have reached out to different professional photographers who've mentored me through the process, reviewed my work, encouraged me to expand my technical skills and my artistic skills as I've gone along. It's been quite a process.
Great. Now, I want to return to the thoughts of the patients and the physicians and the allied health workers. What are you seeing and hearing and feeling on the front lines?
So I think as we look at the images, you can see a transition of how we've experienced the pandemic as frontline workers, starting with a sense of uncertainty and apprehension, not knowing what we were getting into, and then kind of catching our stride, understanding how our different policies and procedures were affecting the way we provided care and the way we interacted as a team. Similarly, I can see the patient perspectives shifting through the time in the pandemic. Initially, quite a lot of loneliness and uncertainty, but again, the ability of people and the desire for people to share their experiences intensified as the pandemic progressed and people felt compelled to share with people the intensity of the experience, the urgency they felt to encourage people to follow the guidelines and get vaccinated.
Maybe we can elaborate on that a little bit more. What do you feel was the motivation of the people, the medical staff, as well as the patients for being photographed in this way?
That's a good question. So for the patients, the motivation was a little bit different for each person. I would say that some people were eager to share their thanks for the care that they were provided with. And this felt like an opportunity to be able to do that in a tangible way. And many people expressed that explicitly. I also believe many patients felt that they wanted the public to see what it actually looked like, so that we were able to move from hearing of statistics to understanding the experience of an individual, and then taking that visual representation of a COVID journey and allowing that to inspire people to do the right thing, to take care of themselves, to take care of their families, and follow the public health guidelines.
Wonderful. Now, Heather, something that we really should touch on before we wrap up is that you really dotted your I's and crossed your T's in terms of getting permission to do this. This isn't the sort of project that anybody should just take on, walk into a hospital with a camera, right?
I agree. The process to get permission to be in the hospitals with a camera was extensive. I went through ethics reviews, privacy and legal, and all layers of the AHS leadership to gain appropriate permission to be in the hospital with my camera. But I think what's most important is the individual consent to participate in this project. Patients and all staff who are involved needed to be able to fully understand the implications of providing consent. And I spend a lot of time ensuring that people do understand that these images will be shared, that their story is important and will be treated with respect and compassion when they're shared.
Well said. Now, one more thing, Heather, before we wrap up. What message of hope do you have?
I think the most important thing that I've learned personally during the pandemic and through the lens of this project is that despite the profound challenges and tragedy that we've been witnessing, there is always good to be found. If you look for it, if you seek it out, you can find that. And that hope, that kindness, that little moment of joy that you might see on a day-to-day basis, those are the things that can be transformational and encourage us, inspire us to keep going even on the most difficult days.
Well said. Well, certainly, Heather, thank you for joining us on the Alberta Doctors Digest podcast. Really do appreciate it.
Thank you for having me on the show.
Thanks again for tuning in to Alberta Doctors Digest, brought to you by the Alberta Medical Association. This has been just one of the many stories from the current issue of our online publication. You can read the entire publication at add.albertadoctors.org. See you next time.